So the next question was, which of the following is a causative agent for papilledema? Your options were rubella, cryptococcus, toxoplasma, and candida. So first of all, it is important to note what is papilledema. So basically, if you say papilledema, so it is the disc edema plus rise in intracranial tension. So if the disc edema is associated with increased intracranial tension, only then we call it as a papilledema. Sometimes the disc edema is not associated with rise in intracranial tension, and that case is called papillitis. So first of all, it is very important for you to differentiate between a papillitis and a papilledema. Now, why this disc edema occurs? Basically, disc edema occurs because of the stasis of exoplasmic flow that happens due to raised intracranial tension. Now, sometimes infections or intracranial space occupying lesions like any brain tumor or any hematoma that is due to trauma, this can lead to increase of intracranial tension. So any cause of meningitis would lead to the papilledema. So most important and the most common out of the options here is cryptococcus. So according to me, B should be the most probable answer here. A few more things that you should remember for the papilledema is that what are the signs of papilledema? So the main important signs of papilledema are dilation and tortuosity of blood vessels. So the blood vessels that you see near the optic nerve head, they are dilated and tortuous. Then there is blurring of disc margins, and this blurring starts most commonly and earliest in the nasal margins. So nasal margin and dilation and tortuosity of blood vessels is an important condition that you should know in early papilledema. Now remember that what are the symptoms of papilledema? The symptoms, because the visual obscuration is not an early sign, so the patient presents with headache and vomiting. Sometimes he also complains that there is transient obscuration of vision. That patient says, okay, I am feeling okay and seeing okay at one point of time, then I am not able to see clearly after 15 minutes, and then it itself resolves. So this is transient obscuration of vision. So this is an important criteria that you should know for a papilledema. Other signs that you can see on the fundus is hyperemia, that means pinkish disc. I have told you earlier that this pink disc can also be seen in the conditions like hypermetropia. Then important condition is elevation of disc. What this elevation of disc means that normally when there is a swelling, it tries to bulges out the disc. So if you can basically focus on the disc with a direct ophthalmoscope at zero power, but during papilledema you are able to focus only at the hypermetropic powers because the disc is now elevated. So elevation of disc, this is seen given in some books like +2 or +3 diopter elevation of this disc. Then the other important thing that you can get is a macular star. This macular star means some exudates are collected near the macula. Okay, so like these some star-like formation is there near the macula. And other thing that you can see is Patton's line. Basically, because of the edema, there can be some RNFL folds that are seen. So that are called Patton's line. In late stages, you get atrophic papilledema. What is atrophic papilledema? That you, instead of getting a hyperemic disc, you get a pale chalky disc. Now this pale chalky disc has No clear cut margins, but it is whitish or yellowish in color. And also, in these cases, you can get calcium deposits. This calcium deposits on disc is called corpora amylaceae. So these are the important features of late stage of papilledema. Now you should also know that what are the causes of papilledema. As I earlier told, that intracranial space occupying lesions like any tumors or brain abscess, they can cause a papilledema. Also, any obstruction in the CSS flow can also cause papilledema. Then few important causes that you should know are preeclampsia, vitamin A toxicity, or vitamin D deficiency, sometimes OCPs, salicylates medication, blood dyscrasias, and spinal cord tumors. These can also lead to papilledema. Now remember one important term, that is idiopathic intracranial hypertension. What is idiopathic intracranial hypertension? That sometimes, in absence of any brain lesion, you can get high intraocular pressure plus a papilledema. So these cases is called idiopathic intracranial hypertension or pseudotumor cerebri. Now, what is the treatment of papilledema? Remember, for treatment of papilledema, you have to treat the cause. So in idiopathic intracranial hypertension, if you have the causes like preeclampsia, salicylate intoxication, or OCPs, or blood dyscrasia, or something like this, you have to treat the cause. Another important cause of pseudotumor cerebri in females is weight gain. So you have to tell the patient if there is pseudotumor cerebri, you have to do a weight loss. Also, you can go for a VP shunt to decrease the pressure. If the patient is not surgically stable, you can give Diamox or acetazolamide tablets. So this is all you should know about the papilledema, important topic.